Welcome to Luck Health Professionals, the podcast dedicated to empowering healthcare practitioners like you. We're here to provide you with evidence-based insights and practical strategies to excel in your daily practice. If you find our content helpful, please remember to like and subscribe so you don't miss a single episode. Now, let's dive into today's topic. Welcome to the very first episode of Luck Health Professionals. I'm your host, Hank, and it's truly special to kick off this podcast with a topic that's incredibly close to my heart, and to have a fantastic guest, Eleanore, joining us for our first chat. Today, we're going to demystify a crucial allied health profession in Australia, exercise physiologist.
And Hank, I'm just as thrilled to be here for episode number 01. As a registered nurse, I've had the privilege of working alongside many incredible allied health professionals. And frankly, I think exercise physiologists are sometimes one of the unsung heroes of our healthcare system. So, Hank, given your background as an exercise physiologist before you ventured into podcasting, I thought it would be absolutely perfect if I got to interview you for this foundational episode. What do you say?
Eleanore, that's a brilliant idea. I'm usually the one asking the questions, but I absolutely love the flip. It's a great way to share my experiences and insights from the ground up. So consider the tables turned. Ask away.
Fantastic. All right, Hank, let's start with the basics. For our listeners, many of whom might be students or new grads from various health disciplines, what exactly is an accredited exercise physiologist in Australia? What do you actually do on a day-to-day basis?
That's a fundamental question, Eleanore, and one I've been asked countless times to my patients and other health professionals. As an accredited exercise physiologist, or AEP, our role is essentially to prescribe exercise as a form of medicine. We are university-qualified allied health professionals, meaning our training goes far beyond general fitness. We work with individuals who have a range of chronic conditions, injuries, or disabilities. For instance, I'd often see clients with type 2 diabetes, heart conditions, chronic back pain, or even neurological conditions like Parkinson's. We conduct thorough assessments, understand their medical history and current health status, and then design and deliver tailored exercise programs.
So it's very clinical, isn't it? As a nurse, I often explain to patients that it's not just about hitting the gym. It's about a highly specific, evidence-based approach.
Exactly, Eleanore. The accredited part is key. Our interventions are evidence-based, guided by clinical reasoning, and always focused on improving a person's functional capacity, managing their condition, and enhancing their overall quality of life. For instance, if I had a client, let's call her Sarah, just a hypothetical name, who had recently undergone cardiac surgery, my role wouldn't just be to give her a general workout. It would involve a very carefully graduated program, monitoring her vital signs, educating her on safe exercise limits, and working closely with her cardiologist and GP to ensure a holistic recovery.
That makes perfect sense. Now, for those aspiring to join the ranks of AEPs, what's the typical pathway to becoming an exercise physiologist in Australia? What kind of degrees and qualifications are we talking about?
The primary pathway, and the one I took, is completing an ESSA-accredited university degree. ESSA, which stands for Exercise and Sports Science Australia, is our national accreditation body, and they set the standards. Most commonly, it's a 4-year Bachelor of Exercise Physiology or a Master of Clinical Exercise Physiology if you've already completed an undergraduate degree in a related field like exercise and sports science. These degrees are quite rigorous, covering areas like advanced anatomy, physiology, pathology, pharmacology, and exercise prescription for various clinical populations.
And I imagine there's a significant practical component to those degrees.
Absolutely vital, Eleanor. Clinical placements are a non-negotiable part of the curriculum. We're talking about hundreds of hours of supervised practice in real-world settings, hospitals, private clinics, rehabilitation centers. These placements are where you truly learn to apply the theory, develop your communication skills with clients, and gain confidence in designing and delivering exercise interventions. It's where you transition from a student to a practitioner. Without these practical hours, you simply can't gain your ESSA accreditation.
So once someone has successfully navigated those university years and secured their ESSA accreditation, where do AEPs typically find themselves working in Australia? What are the common work environments you encountered?
The beauty of this profession, Eleanor, is its versatility. You're not just pigeonholed into one area. A significant portion of AEPs, myself included, initially work in private practice. This can be anything from a small, independent clinic to a larger, multidisciplinary allied health center, alongside physios, dietitians, and OTs. Here, you'll see a broad spectrum of clients, often referred through Medicare's chronic disease management plans or through schemes like NDIS and DVA.
What about beyond the private sector?
Well, you'll find AEPs integrated into public and private hospitals, working in departments like cardiac rehab, pulmonary rehab, or even oncology. We also play a significant role in aged care facilities, helping older Australians maintain mobility and reduce falls risk. Another significant area is occupational rehabilitation, where AEPs assist injured workers to return safely to their jobs, often designing work-specific exercise programs and ergonomic advice. And while less common as a primary role, some AEPs work within sports organizations, focusing on injury prevention and rehabilitation for athletes. There are also opportunities in community health centers, corporate wellness programs, and even research or academia. It's truly a diverse landscape.
That's really impressive, Hank. The scope is much broader than some might imagine. With such diverse opportunities, what are the job prospects like for exercise physiologists in Australia right now? Is it a field that's seeing growth?
From my perspective and looking at the trends, the job prospects for AEPs in Australia are very positive and continue to grow. There's an increasing recognition of the role exercise plays in preventative health and chronic disease management. With an aging population and rising rates of lifestyle-related diseases, the demand for qualified professionals who can manage these conditions through exercise is only going to increase. Government initiatives like the NDIS have also created significant demand for AEP services. I'd confidently say it's a growing and in-demand profession.
That's fantastic news for anyone considering this career path. And for the very practical side of things, what about salary expectations? What can a new grad AEP expect to earn? And how does that generally progress with experience?
This is always the burning question, isn't it? For a new grad AEP in Australia, a typical starting salary might be in the range of around $60,000 to $70,000 annually. However, it's important to note that this can vary based on the specific work setting and location. For instance, some private practices might offer a lower base, but a higher commission structure as your client load grows, while public health roles are often tied to award rates.
And with more experience,
With a few years under your belt, say 3 to 5 years, and depending on whether you specialize or move into a senior or leadership role, you could be looking at salaries in the $75,000 to $95,000 range, or even higher if you establish a successful private practice with a strong client base. There's definitely good progression for experienced AEPs, especially those who demonstrate strong clinical skills and client management. Remote or regional areas sometimes offer higher salaries to attract professionals too.
that's a clear picture of the earning potential. Finally, Hank, as someone who's lived and breathed exercise physiology, how would you articulate the core value proposition of an exercise physiologist? Why is this profession so vital for the health and well-being of Australians?
That's the most important question, Eleanor. The value of exercise physiology lies in its ability to truly empower individuals to take an active role in their own health journey. We bridge the gap between a medical diagnosis and practical, sustainable strategies for improvement. Unlike a quick fix, we equip people with the knowledge and skills to manage their conditions long term. We help reduce the burden on the broader healthcare system by preventing complications, improving functional independence, and reducing hospital readmissions. For example, by helping a client with chronic lung disease improve their exercise tolerance, we're not just improving their breathing, we're improving their ability to perform daily tasks, their confidence, and ultimately, their overall quality of life. We're about sustainable, evidence-based change that truly transforms lives. We're preventative, rehabilitative, and crucially, we focus on empowering the individual.
Hank, that was an incredibly articulate and inspiring overview. It's clear that exercise physiologists are absolutely essential for a healthier Australia, and your passion for the profession really shines through. Thank you so much for turning the tables and letting me interview you for our very first episode.
My pleasure, Eleanor, and thank you for being such a fantastic interviewer. It was a great way to kick things off. To all our listeners, I hope this deep dive into exercise physiology has been insightful, whether you're considering it as a career or simply want to understand more about this vital profession.
Thank you for listening to today's episode. If you found our content helpful, please remember to like and subscribe so you don't miss a single episode. Your support truly means the world to us, and we can't wait to have you join us again soon. Until next time, stay curious and stay healthy.